It gives me great pleasure to join you here today to celebrate great milestone that we have achieved within the management of neglected tropical diseases, as well as the effort we continue to make in the elimination of the neglected surgical diseases. Kenya has continued to show impressive economic growth, as well as raising the standard of living for millions of our population. However, amid this growth, segments of the population are affected by the widening disparities and unequal access to opportunities for health, development, and prosperity. These are the people who are most vulnerable to diseases resulting from poverty, including the neglected tropical diseases and the neglected surgical conditions. Common entities, as has been put before, trap communities in a cycle of malnutrition, anemia, poor learning, low productivity, poor maternal and child health outcomes, and the deepening of the type of NTD complications and disabilities such as blindness, swelling of limbs, organ failure, or even brain damage. In May the year 2013, the world came together and resolved to intensify the NTDs and NCDs and to plan investment to improve the health and social well-being of the affected populations. I would like to urge the county leadership within affected counties to invest in the rollout of this BTS, the Breaking Transmission Strategy that we are launching here today. And at this juncture, I would like to request my colleagues, the panel of experts who will be carrying the mantle to ensure implementation, to join me here so that I can give them the power to proceed.
As Meru County, we are taking health very seriously. We don't want our people to continue being oppressed and impoverished by disease. Our county is working very closely with the national government, led by President Uhuru Kenyatta. Neglected surgical conditions such as cleft lips and palates, fistulas, have for a long time been a burden not only to patients but also to the entire community of Meru. They have been a source of pain and ridicule and embarrassment to those who are suffering those conditions. But they have also been an economic burden to the members of their families. I'm very, very happy because with this partnership today with the Ministry of Health and the G4 Alliance, we shall eradicate these conditions completely.
CIF is committed to improving the lives of children, and elimination of worms as a public health problem has been our goal for a long time, and hence the reason we partnered with the Kenya government to support the Kenya National School-Based Deworming Program, and now are supporting the development of a breaking transmission strategy, which we are very, very excited to see launched today, and we're very much looking forward to the implementation of it and ensuring that Kenya can really be a first in breaking transmission of LF, of trachoma, soil-transmitted helminth, and schistosomiasis, and we believe Kenya can do it.
The World Health Organization has developed a strategic plan of neglected tropical diseases in the Africa region to accelerate and reduce the disease burden through the control, elimination, and eradication of this targeted NTB. Therefore, we are joining you to affirm that Kenya has taken this step even to launch this breaking transmission strategies today.
The vision is that by 2030, every single child that is born with a birth defect will receive treatment. regardless of who they are or where they are from. That every mother, in bringing life to this world, will not fear losing her own. And only through collaboration, cooperation, and collective action will we truly scale to greater heights.
We get to now expand the interventions that we have been providing, and we are also incorporating other interventions that we have not been providing, so that now we have a comprehensive package, which is going to ensure that within a time frame of about 5 years, we will have broken transmission of these 4 important neglected tropical diseases in our communities. And so it puts us on track to be able to eliminate these diseases within the next 5 years, which is a big achievement, and it is also something that moves us towards the global goals for elimination and also our national goals as a country.
I'm glad to say that the strategy we have launched today, the Breaking Transmission Strategy for the Neglected Tropical Diseases, is a very important milestone for this country. It is one of the strategies in the globe that is going to support the country to achieve its dream of universal health coverage, of eliminating some of these neglected tropical diseases. The strategy is focusing on 4 diseases, which are the soil-transmitted helminths and also leishmaniasis, and we're looking at trachoma. And through this strategy, the country is looking forward to eliminating and eradicating these conditions, and therefore giving the Kenyan population a good chance to have a good health and good life.
Hata wale hawakuwa na uwezo wa kutoka huko waende hospitali na tena hawakuwa na pesa za kuenda hosi. Saa hizi watanufaika sana kwa sababu hii mradi ni bure. Saa hivyo ndio sisi tunafurahia.
Then this family, it is very beneficial in our community because they have developed to gather those people and to know them wherever they are. We have located them, and if they are going to help them, they are going to treat them, we shall have benefits because our people will work well and their health will be smart.